Et est-ce que vous craignez qu'à ajouter comme ça des pays sur la liste d'interdiction de vol, des pays seraient portés à devenir moins transparents à l'avenir dans la communication de leurs données médicales? Je pense à l'Afrique du Sud, par exemple.
Très bien. Alors, merci pour l'excellente question. Deux choses. Donc, pourquoi ces pays et pourquoi la deuxième mesure autour là, des tests obligatoires lorsque les gens arrivent au pays. Alors, pourquoi ces pays? Parce que sur la base des informations que nous avons de Santé publique Canada, nous avons la chance d'avoir les experts ici avec nous aujourd'hui, il y a des craintes que justement, il y a un enjeu de transparence. C'est pas une question de mauvaise foi, c'est surtout une question de capacité. Les trois pays qui s'ajoutent aux 7 autres ont plus de difficultés à suivre ce qui se passe au sein de leurs frontières et que par conséquent, il est plus difficile d'utiliser les méthodes traditionnelles de protection des couches multiples pour pouvoir permettre à des gens qui ont séjourné dans ces pays d'entrer au Canada. Donc, ce n'est pas basé d'ailleurs sur la nationalité. C'est basé sur les séjours. Donc, un Français qui est allé en Égypte la semaine dernière, qui veut venir au Canada, bien, il est traité de la même manière qu'un autre, qu'un Nigérian ou qu'un Égyptien là, qui aurait séjourné à travers un des 10 pays identifiés dans la liste. Maintenant, sur l'enjeu de est-ce que ça donne des bons incitatifs, est-ce que ça permet aux pays de travailler ensemble? Bien, la réponse est qu'il faut effectivement faire autre chose pour encourager un niveau de collaboration internationale suffisant. Et on en parlait hier avec les pays du G7. Nous avons convenu de travailler ensemble pour aider certains de ces pays qui ont envie d'être plus transparents, mais qui ont de la difficulté à le faire parce qu'ils n'ont pas les informations nécessaires pour le faire. Et on a aussi parlé de l'enjeu que non seulement maintenant on observe que il y a parfois et souvent des problèmes de quantité de doses, mais aussi des problèmes d'administration de ces doses. Il y a certains pays qui ont de la difficulté de plus en plus à administrer les doses qui sont disponibles. Donc, comment on peut travailler ensemble avec les pays du G7 pour envoyer des ressources peut-être un peu plus spécifiques en matière d'équipement ou de ressources humaines pour aider ces pays à administrer plus efficacement et plus rapidement les vaccins auxquels ils ont accès.
Est-ce qu'à court ou... Dr. New, est-ce que vous vouliez réagir?
Oui, c'est Dr. New. Peut-être je vais ajouter quelque chose de plus technique de la perspective de la santé publique. Comme le ministre Duclos a constaté, c'est vraiment une question d'épidémiologie. On voit maintenant dans quelques pays, peut-être les données probantes qui indiquent qu'il y a la transmission communautaire parce que c'est même les cas signalés au Canada, on voit que les voyageurs qui reviennent au Canada ont passé du temps en quelques pays où il y a maintenant des données probantes qui indiquent qu'il y a la transmission communautaire. Mais aussi, il faut remercier, je pense, que l'Afrique du Sud d'avoir la capacité de détecter et aussi signaler à tout le monde qu'est-ce qui se passe avec ce nouveau variant. Donc, je pense qu'avec les mesures maintenant à notre frontière, c'est vraiment pour gagner du temps, pour mieux comprendre ce virus. Il y a vraiment trois grandes questions concernant le variant préoccupant. Est-ce que c'est plus transmissible? Est-ce que ça donne peut-être les conséquences plus graves? Et aussi, est-ce qu'il y a un impact sur l'efficacité des vaccins? On n'a pas encore les réponses, mais les scientifiques à travers le monde ont travaillé étroitement avec une bonne collaboration pour trouver les réponses. Donc, pour l'instant, ça, c'est une mesure pour ralentir la propagation du virus. Et c'est pas comment, on peut pas, comment dire, fermer les frontières parce que le virus est déjà ici et aussi dans plusieurs pays. Donc, c'est quelque chose que une mesure pour gagner du temps, pour mieux comprendre le virus et pour préparer pour la prochaine étape, peut-être comment on va s'adapter, peut-être changer notre approche. Mais si je peux souligner aussi un autre point que le ministre Duclos a déjà constaté, on a des bons outils ici, déjà au Canada. On a une bonne couverture vaccinale et ce qu'on voit à l'heure actuelle, le variant ou les souches prédominantes au Canada, c'est la souche le variant Delta. Et les vaccins sont très efficaces. Alors, c'est très important d'encourager encore l'adoption des vaccins. Et aussi, à part de ça, on a aussi des bonnes mesures bien éprouvées à l'échelle pour la protection individuelle, aussi à l'échelle de la population. Le port de masque, la distanciation physique si c'est possible, peut-être limiter le rassemblement à l'intérieur parce que tout le monde commence à rentrer à l'intérieur avec l'arrivée de l'hiver. Aussi, la bonne ventilation, toutes les mesures comme ça, c'est très important à continuer à pratiquer, mais aussi c'est toujours important pour toujours suivre les conseils des autorités de santé publique locale selon l'épidémiologie. Et c'est comme ça, dans l'ensemble, on va réagir contre le COVID-19 en général et aussi avec ce nouveau variant. Merci.
En suivi, M. Duclos, il y a l'OMS qui a lancé un appel au calme en demandant d'éviter les mesures brutales qui sont ni fondées ni efficaces. Est-ce que vous pensez que le Canada doit se sentir visé?
Mais je pense qu'il faut effectivement éviter de succomber à la panique. Je pense que les gens qui nous écoutent ont toutes les raisons du monde d'avoir confiance, entre autres parce qu'on fait les bonnes choses au Canada depuis le début de la pandémie. On peut toujours faire mieux, mais je pense qu'on a très bien fait et c'est un message surtout pour les Canadiens et les Canadiennes très bien fait depuis le début de la pandémie, mais aussi parce qu'on travaille beaucoup avec nos partenaires étrangers. Bon, le Canada est dans une situation assez particulière où on a déjà des couches de protection solides là, depuis le début de la pandémie en matière de mesures frontalières. Mais dans ce cas-ci, la santé publique du Canada croit que ces couches additionnelles sont utiles dans le contexte de l'incertitude, comme le Dr. New le disait, l'incertitude qui existe autour du variant là, Omicron.
Yeah, this first one's from Minister Alghabra. We're hearing a lot of reports, albeit anecdotal, about travelers flying currently who aren't being asked for their vaccine proof. They're going through all the necessary checks, but no one is actually asking for their proof. Are you comfortable with the rate at which airlines are enforcing this policy?
Thanks for the question. We've announced a vaccine mandate, a requirement of all travelers on planes and trains last August. We then campaigned on it in the last election, and when we formed government again, we announced that the creation of a two-phase approach for this mandate. Phase one was October 30th, and we granted some grace period for this month, including the allowance of PCR test as a substitute for not being vaccinated. And part of the grace period is given some time to operators and airlines to prepare their systems for checking of all proof of vaccination of all travelers. And what had happened between October 30th and today, we had system of random checks. As of today, all passengers will be checked for proof of vaccination.
And then, Minister Duclos, on the NACI, advice to NACI on the booster shots, are you looking at them to reevaluate their advice on booster shots or change it? Do you think we may need boosters earlier than perhaps they'd suggested?
That's right. We're asking for relatively quick advice, renewed advice on boosters. I know that we know that Canadians are asking increasingly about whether they should and whether and how that should be done, receive boosters. And that question is obviously of greater importance now with the new variant. So we are explicitly asking NACI to come up quickly with a revised view on where and how and to whom these boosters should be administered.
Hi there. My question is for Minister Duclos. Just recently, the CMA put out a report saying there have been thousands of excess deaths due to delayed surgeries and procedures because of COVID-19 complications in hospitals, and saying it would cost about $1.3 billion to address these backlogs by June. Are you looking at increasing the transfers to the provinces to try to best address these backlogs in the hardest hit areas?
Well, thank you. And our own estimate, which is, of course, dependent on the information that we receive from provinces and territories, is that there would be approximately 780,000 delayed surgeries in Canada at this particular time. Our understanding is that those delays are being reduced slowly because the pandemic is relatively under greater control now than it used to be, say, in a few weeks or a few months ago. This being said, there's a lot of work to do to protect the health of Canadians. Now, one more good news is that we've promised in the campaigns very significant and quick investments to address things like backlogs in surgeries, but also access to primary care, long-term care, home care, mental health care. So we have a total of $25 billion that we want to invest quickly in support to the priorities of provinces and territories. And we know that one of these priorities is exactly that, to handle the backlogs in surgeries.
And this morning we had the CEO of Moderna saying he's worried that the current vaccines may not be as effective against the Omicron variant as we've seen with past variants. With that in mind, can you give us an update on what you've heard latest from Health Canada on reviewing some of the antivirals from companies like Merck and Pfizer? Just what the status is there, and has Canada begun purchasing any of these pills?
Well, on the last question, I can tell you that we have very strong and very good procurement contracts with, seven, as you might remember, seven companies, four of which we already have the ability to administer doses from. So it's a portfolio that from the start we knew was going to be very strong, and it did show that we had made, not we as politicians, but experts, made the right choice. And we have 420 million doses on order, and therefore sufficiently so to give Canadians the vaccines that they need. Now, on your first question, I would prefer to turn to Dr. New, because it's an issue which Dr. New knows more about.
Yes, I think if you're referring to the question of therapeutics, definitely, I think we all know the old saying that, an ounce of prevention is worth a pound of cure. And so certainly, as Minister Duclos has said, we've done well with our vaccines in terms of both our procurement and obviously the rollout across the provinces and territories. But we always know that, a certain proportion of the population will be unvaccinated due to, a number of circumstances. And even in those who are vaccinated, we're seeing some breakthrough infections. And so it's always important to look at what's out there in terms of therapeutics, in terms of treating those who do become infected. At the present time, we have quite a number of what we call therapeutics, monoclonal antibodies, and so on, that are being used more in the hospital setting to treat severe cases of illness, from COVID-19, and they're being used obviously by the specialists and in sort of certain circumstances. But what's very promising on the horizon is the fact that there are a number of what we call oral sort of therapeutics, which could be taken sort of out of the hospital setting, which doesn't require the same kind of, expertise because of intravenous administration and so on. So things are looking well. The government of Canada is in sort of advanced stages of discussions with, at this point, two companies, Merck and Pfizer, in terms of what we call advanced purchase agreements. But obviously, at the same time, for Merck, I understand there's a rolling submission that's still sort of being looked at by Health Canada, and we anticipate a similar submission from Pfizer, in the coming days and or weeks. So that's what's going on, and obviously Health Canada will do what they need to do in looking at the clinical trial data to look at the efficacy results from the trials, and then obviously make a regulatory decision, and obviously look at the indications based on the data they receive. What we're also doing, though, then, is that we're looking at having consultations both with, I would say, the clinical experts across Canada, but also with the public health experts in terms of should these therapeutics become available, how would they best be used in sort of in a practical setting in terms of implementation. So all I can say is at this point things are looking promising in both sort of the regulatory process, but also in terms of the planning and thinking about how these types of therapeutics could be best used in the provinces and territories once they become available. Thank you.
Hi, David Thurton, CBC News. Thanks for taking our questions. Can you just clarify for me, when do these measures, particularly testing, when does that kick into place or into gear here? If I heard you correctly, it's today. If so, what time today will travelers arriving into Canada have to do the testing? And what impact does this have on people who are coming from the US, either transiting through? Because of course that has been a backdoor for people to come into the country too, and there have been concerns about testing at that border too.
I'll try to answer the three questions, although some of these would be more in the domain of my colleagues. First, on the matter that Minister Alghabra mentioned when he spoke about when the requirement for people coming to Canada, having spent time in the last 14 days in those 10 countries, the requirement for those people to be tested in their last country before entering into Canada, that was going to take effect tonight. Now, the second thing about orders in council or orders is about the inclusion of the 3 new countries in the set of 10 for those for banning any foreign national having traveled through these 10 countries in the last 14 days, and asking all Canadians that have traveled in these places in the last 14 days to be tested and to wait for their test result. So that those requirements will be put into an order in council, which will most likely apply tomorrow. So in a few hours from now. And for the testing procedures, testing vaccinated and unvaccinated air travelers entering into Canada, that will be done as quickly and as much as possible over the next few days. Now, obviously, that can't take place immediately everywhere at the same speed, but we have full confidence in the system, and in particular in our collaboration with provinces and territories, because some of these testing procedures, testing events, and then the follow-up with quarantine, some of that and sometimes much of that require the collaboration, the participation of provinces and territories. But we believe and we have full confidence that this is going to unroll quickly over the next few days.
So I just want to follow up on that. So how soon, or what is the latest that we could see this implementation of testing? And it's only at airports from what I understand. And will travelers have to pay for this test, or will the government pay for it?
Well, let me give you a number. We are currently across the entire set of entry points in Canada, both through land and through air. We're currently delivering about 20,000 tests per day. And we need to move to about 32,000 tests per day to be able to do what we already do, including randomly testing those that come through the land border. But let's remember that land travelers are either they are tested necessarily if they come unvaccinated, or they are tested randomly, about a quarter of them if they travel to Canada at this particular time. So we'll move from 20,000 to about 32,000, which is a significant increase, and that's why it's going to take a little while for that to happen.
Just, I'm sorry, Chris, I know you were next, but your outlet got a question, so we're going to get other outlets who didn't ask a question to ask questions.
CTV. I was the only one in line, CTV, so CTV
let's go CTV, then the Devoir, and then the phone lines.
He came up after me. So.
And the ministers have a hard stop at 5:08, so CTV.
Discuss later.
Hi, Jordan Gowling, CTV News. My first question is your government considering a blanket travel ban, as Israel has done? I mean, is really this piecemeal approach of banning certain countries really going to be effective, given that this variant is now in Britain, Netherlands, and elsewhere?
Well, the first thing I want to say in response to that question is that the government will never hesitate to put in place the protections that are necessary to protect Canadians from the virus. That includes putting in place the travel restrictions, including those who are transiting through the listed countries, 3 of which we are adding to today. It includes making sure that we have the necessary testing regime. It includes making sure that we have as a baseline of protection vaccinations, which is the first and best line of defense against the virus. So we have never hesitated to follow the advice that we're getting from our public health care officials, which we continue to receive in real time, particularly with the advent of this variant of concern. And we believe that that the measures that we have in place are appropriate. We know that the Canadians are going to watch this very closely, as are we, and we'll take whatever decisions are necessary.
And just to go back to NACI recommendations on boosters, Minister Duclos, can you give us a specific timeline on that? And should provinces even be waiting around for these recommendations, given that the U.S. and the CDC have acted very quickly on moving that out?
Okay. Well, there are 2 reasons to ask NACI to do this quickly. By the way, this is an independent committee, and we're not going to force any experts to provide advice which they find is too early for them to provide. So the 2 reasons are, A, that there is a growing interest among Canadians from different provinces and territories in this particular issue. Christmas is coming. Many Canadians have been vaccinated now by close to 6 months, in some cases more than 6 months, and they hear that outside of the country, and some of them that you've quoted, the use of boosters has been more widely available. So they are curious, and they would like to know from the federal government what the federal experts think about the use of boosters overall across Canada. The second reason is obviously the advent of this variant, which is a source of concern, not a source of panic, a source of concern. And in that context, NACI may want to consider a precaution within the current environment as one more reason to renew and revise its advice.
Thank you.
Bonjour Boris, pour Le Devoir, je voulais savoir, c'était pas très clair peut-être pour les voyageurs canadiens. Je comprends que pour tous ceux qui reviennent par la voie aérienne, il y aura un test à l'arrivée à l'aéroport, sauf ceux qui viennent des États-Unis. J'aimerais savoir qu'est-ce qui arrive avec la quarantaine. Il y a eu un temps où on avait une quarantaine dans un lieu sécurisé, une quarantaine de 14 jours à la maison. Est-ce qu'il n'y aura rien de ça? Juste un peu expliquer ce dont les voyageurs canadiens peuvent s'attendre.
OK. Donc, c'est 2 plus 2. Alors, les 2, c'est États-Unis et non-États-Unis. Alors, les mesures d'aujourd'hui concernent les voyageurs qui viennent d'un autre endroit que les États-Unis. L'autre 2, c'est vaccinés, non vaccinés. Alors, les mesures pour ceux qui ne sont pas vaccinés ne changent pas. Elles sont toujours appliquées depuis de très nombreux mois. Ces gens qui arrivent au Canada, que ce soit par voie aérienne ou la voie terrestre, doivent se faire tester à l'entrée au pays, doivent s'isoler pour une quarantaine de 14 jours et se faire tester une 2e fois au jour 8, mais continuer leur quarantaine jusqu'à la fin des 14 jours. Donc ça, c'est le 2 plus 2. Maintenant, ce qui change aujourd'hui, c'est pour les voyageurs vaccinés qui arrivent dans les aéroports canadiens d'autres pays que les États-Unis. Ces voyageurs vaccinés qui, présentement, n'ont pas toujours besoin de faire un test et n'ont pas besoin de s'isoler, même s'ils font un test, vont devoir faire un test et s'isoler le temps que ça prend pour recevoir le résultat de leur test.
Boris, question suivie.
In English, if you want to. Okay, so it's try to be equally logical. So it's 2 plus 2. So you've got the United States and the rest of the world. So what we're focusing on today is measures for people coming from the rest of the world, including the United States. Now, the other 2 is vaccinated, unvaccinated. The rules around those that are not vaccinated are not changing today. No, it's the same rules apply. When someone comes into Canada with a right of entry, that person needs to be tested at the land or at the airport, and that person needs to quarantine for 14 days and need to be tested once more on day 8. What changes today is the rule for those that are vaccinated coming into an airport in Canada. Those people will need to be tested on arrival at the airport and isolate and wait until their test result is known before exiting their isolation period.
Merci. Ma question de suivi sont pour les docteurs de la santé publique. J'aimerais savoir combien de cas du variant Omicron sont répertoriés au Canada en date de maintenant et si les mesures annoncées par le gouvernement du Canada vous satisfont ou si vous auriez aimé quelque chose de plus. Est-ce que vous êtes rassuré, autrement dit, par rapport à l'entrée du variant Omicron, par rapport à ce qui est annoncé?
Bonjour, c'est Dr. Yu. Peut-être je peux commencer et peut-être Dr. Tam peut aussi ajouter. À date, on a 4 cas signalés de la province de l'Ontario et aussi un premier cas au Québec. Et honnêtement, je ne sais pas avec la différence avec le temps avec Alberta, mais je pense que Alberta est en train de peut-être confirmer, vérifier aussi un cas. Donc, si je peux compter, c'est comme peut-être 6, peut-être jusqu'à 6 à date, mais on attend peut-être des autres cas au Canada parce qu'on sait maintenant avec notre bon système de surveillance, aussi nos laboratoires est bien équipés pour faire les séquençages et tout le travail nécessaire pour identifier le variant Omicron. Donc, ça, c'est une chose. Et pour la deuxième question, si je comprends bien, Dr. Tam et moi et les autres, on fournit toujours nos recommandations. Qu'est-ce que les données probantes nous fournissent comme l'information. Et avec l'information, Dr. Tam, moi et les autres, tous les experts scientifiques, santé publique, on donne nos recommandations, mais aussi nos options aux décideurs, aux ministres. Et c'est sûr, c'est confidentiel. Il y a toujours plusieurs options. Et en fin de compte, c'est vraiment les ministres qui décident finalement c'est quoi les mesures ou des décisions à prendre. Donc, c'est ça ce que je peux vous dire. Et pour l'instant, comme j'ai déjà constaté, on voit que les mesures à notre frontière, oui, c'est une mesure pour l'instant, je pense que pour ralentir un peu la propagation, pour gagner du temps, pour mieux comprendre le virus et aussi les grandes questions, les 3 grandes questions, toujours concernant les variants préoccupants. Et donc, on va s'adapter au fur et à mesure comme c'est nécessaire. Merci.
Non, on va passer aux lignes téléphoniques, Chris.
On quarantine, okay? So just because
Chris, il y a des règles à suivre.
I'm an English network, I need the clarification on quarantine. So are people going to have to quarantine in quarantine hotels? Are they going to have to quarantine in their homes without other family members because we're getting into Christmas, the holidays? We're looking for clarity about the quarantine for the unvaxxed and vaccination. And that's just my question. I need that clarity, please.
Good, and I'll try to be clear. So what is called the designated quarantine facility, that's going to be used only for two types of travelers, those that come into Canada without a safe place to quarantine, and those that come to Canada from the 10 countries that we have signaled. The other travelers, in particular those that are vaccinated, Canadians that are vaccinated returning to Canada, don't need to go to a designated quarantine facility to wait for their day 1 test result.
Bon, alors, puisqu'on peut maintenant passer aux lignes téléphoniques, il nous reste à peu près 10 minutes. Donc, on va commencer avec une première question. Gardez ça court, les questions et les réponses, s'il vous plaît. Opératrice ou opérateur?
Thank you, merci. You may press star 1 if you have a question. Vous pouvez appuyer sur étoile 1 si vous avez une question. The first question is from Tonda McCharles from the Toronto Star. Please go ahead.
Yes, hi. Minister Duclos, I wonder if you could just clarify the testing requirement for air travelers arriving from non-U.S. countries. Do those people still have to do the the 72-hour pre-departure PCR test, in addition to the on-arrival test? And for the on-arrival test on day one, who pays for that, and and what is the cost of a test like that?
The answer is yes to your first question. They need to do a pre-departure test before arriving to Canada, and they need to do a day one test if they are vaccinated. If they're not vaccinated, as I said earlier, a day one test, a day 8 test, and a 14-day quarantine. Now, who pays for the arrival test? That's the federal government. It's always been like that, and it will continue to be so.
And can you speak to your thinking around why you've chosen to add 3 more countries when, and I think you addressed some of this in French, but when it's clear today that this variant has popped up in many other countries, Australia, Hong Kong, Belgium, well, you're banning Egypt because a traveler came through Egypt, but in Belgium, it's shown up there, right? So I'd like to understand why you feel that a more general travel suspension isn't in order.
For 2 reasons. The first one is that community transmission in the 10 countries, as Dr. New said earlier, is of concern, not only to Canada, but to our international partners. We were discussing that yesterday with the G7 health ministers. Now, the second reason, to explain part of your questions, is that we have double layers, well, in fact, triple layers. Because when someone travels, say, from a particular country to the UK before boarding to come to Canada, that person will first be subjected to UK rules for traveling, and then they will ask to show a pre-departure test in, say, London before boarding on a Canadian plane, and then when they arrive in Canada, they have another test, a day one test, to make sure that they don't have the vaccine and the variant. So that's because both of the strictness of our border measures, which is a level of strength that you rarely see in other countries. So we compare very favorably from the start of the crisis with all comparable countries when it comes to protecting the health and safety of Canadians because of our border measures. So it's because of that. It's also because of our geographical location. Now we have only one land border, and everyone else needs to enter by an airport. So because of that, we have this ability, this unique ability to have multiple layers of protection, which is sometimes more difficult for other countries.
Prochaine question au téléphone.
Thank you, merci. The next question is from Christy Kirkhope from the Globe and Mail. Please go ahead.
Hi, good afternoon. If there's any concern that perhaps Canada could end up on a travel ban list of another country, given the fact that we already have a number of confirmed cases here, and there are investigations underway for several other cases.
Well, the good news about having a good system, as we have in Canada, is that we can identify the cases. So it's perhaps a bit strange to say so, but when we detect and communicate the presence of cases in Canada, that's good, because it just says that our public health system works. And the fact that we were able to identify those cases of travelers not long after they have landed into Canada, that's a great testimony to the fact that our public health system, both at the federal and provincial levels, work as they should. Nothing is never perfect. As Dr. Tam might want to say in a moment, there will be most likely community transmission of the new variant at some point in Canada. We see no evidence of this now because, as I said, we have been able to detect the cases of those travelers because of our border and other public health measures. Dr. Tam, would you want to add to that?
Yes, thank you for that question. And maybe just also partly answer what Tanda McCharles had asked before as well. So we use different criteria for flagging countries of concern. So the 3 additional countries that we're adding today, they have not yet reported Omicron variant in their own country prior to other countries reporting importations from those countries. So including Belgium, Israel, Hong Kong, South Korea, and now Canada, who've detected cases before the country of origin has detected cases. And this tells us that there may be some uncertainty in the country's overall epidemiologic situation and their ability to detect and respond. These countries also have very low vaccine coverage. And as I've said, exported cases, and they have not yet reported themselves. Another parameter we've looked at is our positivity rate on arrival in Canada. So we have this post-arrival testing, and from that, we could detect that there's been a rise in positivity rate, for example, from Egypt and from Nigeria. And indeed, we now have confirmed Omicron cases. All of our cases reported so far have been from Nigeria. And then the volume of travelers into Canada. So these are the several criteria that we use to pay particular attention to certain countries.